Well, in 1862, disease and terror struck Victoria. The dreaded word smallpox rang across the harbour and to other parts of BC. Before it was over, thousands had died. Bruce Kirkpatrick now with This Week in History.
In 1862, the Songhees lived along Victoria's inner harbour. Northern Haida, Tsimshian and Tlingit visitors lived among them and camped along the shores of what is now Rock Bay. Smallpox, likely from miners from Oregon and California, struck suddenly. It was a time of many crowded native settlements throughout Greater Victoria. First Nations people from as far north as Prince Rupert came south in huge canoes to trade. In 1862, they sailed into a sea of smallpox.
This was the first public health crisis, and it was of huge scale. The death rate was the equivalent of the Black Death in Europe. A third of the Aboriginal population of British Columbia was killed in the space of less than a year.
March 22, 1862, This Week in History, Governor James Douglas dispersed the crowded native settlements. Natives went in small groups to isolated areas to try and prevent the spread of smallpox. Through it all, the Songhees survived, thanks in part to medicine doctors brought in ships from England. Big medical chests, like this one at the Royal BC Museum, with cowpox vaccine taken from the sores on cows, and it was discovered because
the milk maidens in ancient times, they found that they never got the smallpox, and they figured it had to be something related to the cows, and that led to the initial research.
Another reason most of the Songhees members survived is the fact they moved to Discovery and San Juan Islands, away from the center of smallpox on the shores of Victoria. Dr. John Helmken vaccinated as many as he could, including a chief known as King Freezy.
Because of Dr. Helmken, all those people that he inoculated, they survived. And because when you inoculate a small number, that helps the rest of them survive.
3 years earlier, Governor Douglas had built an isolated hospital, Royal Hospital, had only 10 beds, and was instantly overcrowded with smallpox victims. On April 1, 1862, Reverend Garrett expanded a smallpox hospital behind the Royal Hospital, and it too was overcrowded. Tents and huts were destroyed, but blankets and clothing reused, which fueled the spread of the disease. Meanwhile, the Reverend John Sheepshank walked from Victoria to Barkerville with cowpox vaccine and a small knife he used to scrape people's arms.
He inoculated 30 First Nations that he met along the way, and a year later he met somebody from that group who said everybody inoculated lived and survived the epidemic, but the 8 people who were away picking berries died.
Along Victoria's harbour, archaeologist Grant Ketty has found remnants of native life.
We have European pipes that the First Nations were smoking, and parts of guns, such as a gun flint, and this is a powder flask, and some of the native trade beads.
The smallpox outbreak of 1862 killed 1/2 to 3/4 of all First Nations people on the BC coast alone, and spread elsewhere.
This Week in History, brought to you by the Royal BC Museum, bringing British Columbia's stories together.